Hi there. This is the third part of why do I do this? Why fibromyalgia? Fibro has been called the intangible disease because its diagnosis is of exclusion, meaning there is no actual test to tell you that you have fibromyalgia. Some guidelines are based on the most common scenarios and statistics. There's a lot of back and forth regarding new tests, but in reality, there's no gold standard. And the diagnostic tool is difficult. Some people spend a long time going from provider to provider until they're finally diagnosed, and many providers have little experience treating it. So most patients are sent to specialists like rheumatologist or pain management, but honestly, many doctors just don't want to deal with it because it's iffy to diagnose, and there's also no set guidelines for treatment. So they go like, why bother, right? Patients with fibromyalgia often feel like the physicians are not listening to them, that people around them are not taking into consideration how they feel, and they usually feel ignored. They wish to have a defined treatment and diagnosis. Like, for example, when you have diabetes, let's say, they tell you, okay, so here are the tests, they're back, you have diabetes. This is how we treat diabetes. We're going to start with this treatment, and this is the goal, and here's the prognosis, right? On top of that, of being the intangible disease, fibromyalgia has also been labeled as a no-cure condition. It's hard for a patient seeking relief to hear those words. People with fibro can become outcasts. They have been ignored, and I decided to work with them because there is very little relief nowadays. Women with fibro are often called lazy at work or at home, or crazy because they're making up their symptoms, or selfish because they're ruining trips or the vacation or families, of relationships, marriage, you name it. I know because I've spoken to them and I want to help them. I believe that they do have a condition, but also I know that there is a cure. They're not making things up. They're not crazy. They're not lazy. They're susceptible. They're very sensitive. And it is okay to feel too much. You just need to learn how to process these feelings and emotions in your body so it doesn't take a toll on your body. Picture this humongous iceberg. The physical symptoms are that part above the surface, and that's where traditional medicine is focused. The deepest part is the actual origin. The current treatment is like trying to bring down an iceberg with a little ice pick. I've been an outcast and I know how it feels. And I have to tell you, there's hope, okay? My method works. I've helped many people. It requires commitment and it's not for everyone, but if you're ready, I'm here to help. So don't hesitate to reach out. We will get to the deepest part of that iceberg, and you will definitely feel better. See you in the next video. Bye.